How could you do that, dude?
I swear, I'm so sorry. I can fix this. I have a med kit in my car. I'm gonna go get that med kit.
You gotta help me, man. This is not good.
All right, here we are.
It hurts so bad.
Let's see what's wrong here. You got.
Oh, it's not hurting anymore. I can't feel anything on my arm. Oh my god, just cut my arm off at this point.
Listen, man. Do you have a hotspot? My name is Max. I'm a nationally registered and Florida licensed EMT. And something that surprised me when I was completing my clinicals and talking to EMS providers who have a lot of experience is the idea of a rescue Randy. There's a stereotype of people who are typically new to EMS. They have a hero complex, they buy a ton of personal gear, make their job their entire life, and take every call personally, all while thinking that they're the smartest person in their agency. They say things like, "I fight what you fear," and might get a cringy tattoo. They pull over for car crashes off duty and try to direct the scene when an actual ambulance shows up. But then on the other end of the spectrum, there's the EMS provider who says, "It's just a job." These people are typically very experienced, very burnt out, and they don't see their job as anything more than that, a job. They don't take any calls extremely seriously. They don't lose sleep over a patient having a bad outcome, and they especially don't carry medical gear off duty and would never stop to help someone if they're not on the clock. They keep work and life separate, even if work happens to pop up around their life. And this spectrum got me thinking. There must be a delicate balance between being a rescue Randy and being somebody who considers it just a job and nothing more. On one hand, having a hero complex and taking the job extremely personally is going to be bad for your patients, and you're going to get burnt out quickly. But on the other hand, leaving your work at work is not entirely possible. Just because you work with medical emergencies doesn't mean you're never going to have one. Stopping to help people if they're hurt, it's a good thing. Trying to direct incoming EMS, that's not a good thing. Regardless, a lot of EMS providers don't actually carry their own medical equipment off duty. It's considered part of this rescue Randy stereotype. Meanwhile, a lot of non-providers actually do carry medical gear. So it creates this weird paradox. The people who do know how to use the medical equipment don't carry it. The people who don't know how to use it do carry it. So again, this got me thinking, how effective are med kits really? If you are a civilian carrying a med kit, trauma kit, IFAC, whatever you want to call it, how effective are you? Are you actually going to harm the patient, or are you going to help them? Well, it all depends. One thing is for sure though, bleeding sucks. And most of the time, it can be stopped pretty easily. According to Stop the Bleed, a person can bleed out from a major arterial bleed in 3 to 5 minutes. I know from personal experience, the average ambulance response times in my area are about 8 to 9 minutes. But it really depends on the day or the time. Regardless, it's important to manage bleeding or hemorrhaging as soon as possible. According to a study from the USAISR, Military Medical Institute, trauma victims who lose less than 15% of their blood have only a 6% mortality rate. However, for patients that lose more than 15% of their blood, their odds of passing jump to 86%. Now, obviously, this data is a little bit skewed. If you ever cut your finger or something, you're technically a trauma victim who lost less than 15% of their blood. But according to a collaborative 2018 study from multiple medical schools, universities, and hospitals, civilian tourniquet use was found to be independently correlated with a 6-fold reduction in patient mortality. But that's specifically for patients with peripheral vascular injuries, which just means bleeding on the arms or legs. This is because a tourniquet wouldn't actually do anything for a bodily injury or something. In case you don't know what a tourniquet is, it's essentially a medical device that just clamps down on a limb in order to stop blood from flowing to it. Maybe not entirely, but it definitely reduces blood flow. This is obviously bad for the limb, and in some really bad cases, the limb might have to get amputated later. But it's often very necessary in the case of serious bleeds. But going back to the original question, is there any reason to actually buy a tourniquet? Can't you just improvise one using a belt or something? Well, yes and no. The simple answer is this: don't improvise a tourniquet if you don't know what you're doing. Stop the Bleed courses teach how to make an improvised tourniquet that actually provides enough circumferential pressure to stop limb bleeding, while also not being so thin as to create any lacerations. As a general rule, don't use a belt. Real tourniquets have something called a windlass that you crank in order to actually tighten the tourniquet down. Belts just can't do that. And there are some studies out there that state if you don't have proper circumferential pressure, you might create something called paradoxical bleeding. So if you're unsure of what to do in the case of somebody bleeding, just use direct pressure. As an EMT, what I was taught for bleeds was just direct pressure, direct pressure, direct pressure. What that means is taking a gloved hand, pressing it directly against the wound with gauze between your hand and the wound. If you want to know more, I recommend getting a Stop the Bleed certification. They're super quick and easy, and I'm not affiliated with them in any way, but I'm certified by them, and who knows, maybe that information might save a life. With that being said, I do have a gripe with them. They commonly quote that 20% of all people who die from traumatic injuries die from preventable blood loss. And as far as I can tell, this is just completely made up. Correct me if I'm wrong, but I can't find a single clinical origin for this quote. The further I go back, the more I see the word approximately and estimated in terms of this quote, but nowadays they just use the quote like it's law. In fact, a St. Louis University School of Medicine study showed that of 6.7 million trauma patients, only 1,074 died exclusively from bleeds that could have been stopped by tourniquets. That represents only 0.4 of the 244,000 mortalities included in the data. Admittedly, however, this data is a pretty strict definition. It only includes extremity bleeding and doesn't include bleeding from junctional areas or the head, neck, or torso, where bleeding may be stopped via direct pressure, occlusive dressing. Also, 1,000 deaths is still a lot of deaths, even if comparably small to the total count of trauma mortalities. So, the exact number of people who die from preventable blood loss is really unknown. But the one thing we definitely know is that it happens. So to everyone watching this video, get some sort of training to stop bleeding in an emergency. I recommend a Stop the Bleed course, even though I'm not affiliated with them. I just know it's super easy, free, and doesn't take much time at all. So it's settled then. Carrying gauze, gloves, a tourniquet or two might be worthwhile. But what about everything else in the typical med kit? If you Google car trauma kit, the first results you'll see will have NPAs, splints, emergency medical blankets, burn dressings, eye drops, and dozens of other items you might find on an ambulance. Do those things help at all? Well, again, it depends. The biggest factor, in my opinion, is ambulance response time. If ambulances take an hour to respond where you are, maybe you could think about including more gear. For most people, that isn't the reality. The reality is that an ambulance will be there within 10 to 15 minutes, and all those interventions won't be extremely necessary. For example, if you sit around and splint a person's leg with your own supplies for 5 minutes, EMS is just going to show up the second you finish. It's better to let the professionals with training try to do something like that, rather than try to hack something together that they're going to have to waste time cutting off anyways. You could make an injury even worse if you're not formally trained with that specific piece of gear. For example, you come across a person unresponsive with a GSW to the chest gasping for air, and you decide this is your time to shine. You get straight to your med kit and you take out a chest seal. You apply the chest seal and you tape it down all around before calling 911. What you may have just done is given someone an unnecessary tension pneumothorax, a life-threatening emergency condition that requires immediate invasive surgery because you applied the chest seal incorrectly and delayed the 911 response. If you'd have just gloved hand, put direct pressure, and called 911 immediately instead, that might not have happened. This is obviously a nitpicked example, but this extends to a million other things. If you are not trained in the gear, you might use it incorrectly and create more harm than good. Also, you might not be trained to pay attention to scene safety. How did that person get that GSW? Will you be next? Are you gonna double the work of incoming EMS crews by becoming a victim yourself? The most important part of being a civilian or bystander in an emergency is activating the actual emergency response system by calling 911 and listening to the dispatcher's instructions. Trying to help someone in need is a good thing, but do not use gear that you're not trained to use. So here's my advice. Carrying medical equipment is something you should consider. What exact medical equipment you carry ultimately depends on your level of expertise and ambulance response times in that order. A lot of experts agree that everyone should carry gauze, gloves, and tourniquets regardless of ambulance response times. They're easy to use, and bleeding is the biggest problem that needs to be dealt with prior to EMS arrival, even if EMS gets there quickly. Beyond that, only carry gear that you are trained to use and gear that actually makes sense with the ambulance response times in your area. If an ambulance only takes 10 minutes to reach you at any given time, carrying something like splints seems a little bit unnecessary. With a limited budget, the evidence suggests that that money is better spent on a tourniquet or two. If you find yourself in an emergency like a car crash, immediately call 911 and listen to the dispatcher's instructions. If you decide to help someone in a medical emergency before EMS can get there, don't try to establish command over the scene as an off-duty civilian. Simply give a quick report to the incoming crew and leave if they don't need help. They might ask you to stay to give a report to a police officer or something, but that's it. Personally, if I had enough money, I would just carry a couple of tourniquets, some gauze, and some gloves in my car as an EMT. That being said, I don't have the money. Tourniquets are pretty expensive, so personally, I just carry gauze and gloves. If I see a really bad accident on the road, I'll pull over, I'll call 911, and I'll try to help in any way that I can. In general, I would try to limit my time on the scene and limit my number of interventions to a minimum. I would absolutely never put an NPA into somebody's nose or try to splint an extremity. I'd just be focused on stopping bleeding, maybe giving some core vitals to dispatch, but that's about it as like an off-duty bystander. At the end of the day, you are protected by Good Samaritan laws, but you also don't have a duty to act. Basically, any intervention carries some risk, so leaving that risk to people that do have a duty to act and do have medical direction, probably best for you as an individual. Given the fact that most people don't really have formal training in how to use most of the stuff in their med kit, minimizing interventions is probably best for the patients as well. As a bystander in a medical emergency, your biggest job is to activate the emergency response system. So in conclusion, number one, yes, Medkits are useful. What you carry in the medkit ultimately depends on your level of expertise and ambulance response time. The current literature suggests items for bleeding control, such as tourniquet and gauze and using gloves to protect yourself, are the ultimate priority. Number 2, do not use gear you are not trained to use. You may do more harm than good. If you want to carry more gear, get trained first. Number 3, your job as a bystander in a medical emergency is to activate the 911 emergency response system by calling 911 and listening to dispatcher instructions. Providing care is typically secondary to that. And number 4, when EMS does arrive, give a concise, quality report and follow their instructions. Do not try to control or direct the scene.